Hi everyone, this is a tutorial on how to hand express colostrum in the antenatal and postpartum periods. The first thing we're going to cover is the technique and some common mistakes to avoid. So the first thing we need to think about is our hand position, and we're going to use our thumb and our middle finger into a C shape like this. And it has to be your middle finger because that's your longest finger, so you can get right round. And the thumb goes on the top and the middle finger goes on the bottom. And it's this curled round shape, a C shape. Imagine you're making a circle and splitting it apart, not straight out fingers like this. Next thing we need to think about is the position of our hand on the breast. Okay, so around 2 centimetres above the nipple and 2 centimetres below the nipple is where we want to start. So thumb here and middle finger here. Areola can sometimes be a guide, but everybody's areola is a different size, so don't always just go on that. You can also feel for the change in the tissue, and that's where you want to start. Okay, we're going to forget about the breast for a second now, and we're just going to practice the movement that's going here, because I see a lot of people spreading their fingers out like this. This diameter here is not going to change for the first step of the expressing, okay? So this diameter, whatever it is, about 5 centimetres wide, it's going to stay like that in the first step, okay? Staying there. So the first thing we're going to do is just move it straight backwards. Imagine that your body is not there and you're just practicing moving this straight backwards, straight back, okay? Just think about that. If you are doing it on yourself straight away, imagine that you're aiming for your ribs, your spine. Okay, so now we're doing it on the actual breast. That backwards movement is as far back as you can get, basically, until you meet resistance. You're going all the way in. Don't cause yourself harm, obviously, but it's deeper probably than you think you need to go. Just really think about back. Okay, so we've done that backwards movement. The next thing is the thing where the milk is going to come out, okay? So you've done your back. Your fingers have stayed the same width apart. Now they're going to pinch together as much as you can. Again, don't hurt yourself, but you're just trying to meet your fingers together, okay? The milk will be expressed at this point. You are not sliding your fingers forward onto your nipple. You are not pulling your nipple out like so many people apparently want to do. Okay, you're going to damage yourself if you do that. You're not actually touching your nipple at all. You're still just on the areola. Okay? Don't go near your nipple. Leave your nipple alone. That's just an exit point. Babies don't suck the nipple. The milk comes out of the nipple, okay? And you're doing the same with your fingers as the baby would be doing. So imagine you followed all the steps exactly as I've said them and there's still no colostrum there. That's okay. There's not necessarily any there yet. But nipple stimulation and attempting expressing is something that's going to stimulate your breasts to start making the milk, because you're getting that signal to make the milk. There's a demand, so we'll make the supply. Okay, it may be, however, that you do have colostrum there and you just need to change your technique or change your position. There's milk ducts all around your breasts, like the surface of a clock, okay? Your ducts go right high up into your armpits, so massaging can help for a start. So warm compresses, generally just massaging the whole breast. You can use your fingers, you can use the heel of your hand or your knuckles if you do it gently, right up. So imagine that you didn't get any here, top and bottom. You can try left and right or a diagonal position. Basically just try all of them. The same as if you did get colostrum in this place and then it starts to slow down, or you want to stimulate all of them, you can do it all the way around like a clock face. The next thing you need to think about, especially if it's antenatal, is the storage and collecting the colostrum and how you're going to do this. So usually we use a 1 ml sterile syringe, okay? So it looks like a small amount, but colostrum comes in such small volumes that this is the perfect thing to start with. So you can actually express and collect all by yourself without any support, but it can be very fiddly and you need to practice using one of these first. These are free if you're in the UK, through the NHS, you shouldn't be having to buy them. Ask your midwife to give you some from the hospital or a maternity support worker. Okay, so the main collecting thing is through suction, as all syringes are. So you're going to use your middle finger and you're going to hold it with your thumb and your index finger. You're going to use the middle finger to push the syringe down to cause the suction. When the colostrum comes out, you're going to hover just below it and scoop and suck at the same time. And the suck is from you pushing away like this. When you get a little bit more and it's further down like this, you can use your little finger or any of your other fingers. Basically, you just want to push that away. You can use your thumb. You're just using one hand to make the suction by pushing the two away, like that. It's important that you know how to get rid of the air as well inside these, because it's often the case that you'll get your syringe all the way down to here and you might only have 0.05 of colostrum and you've got all this air above that you want to get rid of. Sometimes the colostrum will get stuck at the top. So what you need to do is suction more so that the colostrum then falls down. Then you want to tap it so that then the colostrum really, really falls right to the bottom. And then you can slowly get rid of the air out of the top so that the colostrum stays at the bottom, and then you've got all of this suction power with the length of your syringe. So for duration of expressing, I would usually say either 15 minutes until it starts to feel uncomfortable or until there's no colostrum left, and then start on the other side. If you're expressing antenatally to help with your supply, then you can basically just do it whenever you feel like doing it. Don't overdo it so you make yourself sore, but don't underdo it so that you're only doing it, once a week or something, because you're not going to get the optimal results. If, however, you're expressing postnatally because your baby's either unable to feed or reluctant to feed, perhaps the baby's on a special care unit, then you need to be expressing the same amount of times that you would be feeding the baby, which is 8 to 12 times in a 24-hour period. And this is more important at night, so don't skip those nighttime expressions. Like I said before, these are sterile, so it's very important that nothing other than your nipple or the colostrum touches this end here. So don't put it down on the side. If you need to put it down for any reason and you don't have a lid, you can put it back inside the sterile packet as long as nothing's contaminated the packet. As soon as you can, you need to put a lid on this. The lid should also be sterile and it goes directly on the end without you touching the inside. These should also be supplied at the same time as the syringes. When expressing antenatally, you need to store your colostrum. So it's going to go in the freezer with a sticker of the time and date that you expressed it on each individual syringe. And it's fine in the freezer for 6 months. When you're expressing and breastfeeding, you release a hormone called oxytocin. This is the same hormone that causes contractions when you're in labour. So there is some evidence to suggest that expressing can induce labour. This is often a good thing if you're wanting to avoid induction, if you're doing it after 37 weeks. But for that reason, we do not suggest that you start expressing before 37 weeks. There are several benefits to expressing antenatally. It takes the pressure off generally knowing that you've got colostrum there because you've physically seen it before the baby's even been born. It's very good for regulating all babies' blood sugars, especially those where the mother is gestational or type 2 or even type 1 diabetic, because the baby's been exposed to higher levels of glucose in utero. It's expecting that it's going to be like that ex utero as well, so they produce more insulin than a normal baby would, and that brings their blood sugar right down and they can be very unwell. If you've got the colostrum to give them straight away without having to worry about them latching, then that's more likely to stabilise those blood sugars. If you either know that your baby's going to be admitted to the neonatal unit or it's unexpectedly admitted, then you've already established your supply and your method of expressing, and you can continue to do that without any problems. Hand expressing can also be really good even when you are exclusively breastfeeding, not collecting it into syringes and giving it to your baby that way. If you just express a little bit onto the nipple, it can often stimulate the baby to start rooting, knows where it's going, it gets a little taste and it's like, oh yeah, I'll have a bit more of that, thank you. Also, if you get engorged or if you've just generally got a very hard breast because it's so full of blood, you can express a little bit and then that will release the tension, and then the baby has got a softer thing to latch onto. It can also just take a bit of that tension away for you if you're feeling discomfort. Another important thing to note is that if you have mastitis, engorgement, or are taking antibiotics, you mustn't stop expressing. A lot of people will think, oh, well, that breast is infected, so I must not give the baby any of that milk. The baby has antibodies from your breast milk, which is going to support it against whatever infection is in there. If you stop all of a sudden expressing from that breast, it's going to worsen that engorgement and that infection, so you must continue. Always ask a pharmacist first, or your doctor, GP, midwife, anybody that knows about the antibiotics that you're on. But almost all the antibiotics that are prescribed for this are safe for breastfeeding, and your pharmacist will know yes or no. If you're experiencing any discomfort during expressing, then just make sure that you're doing your technique as it's been shown. Make sure that you're not doing any of the common mistakes that I said about before, like the spreading of the skin or the pulling out of the nipple. You do have to press quite hard when you're going back and together, so that can be a little bit discomfort, but not necessarily painful. If you imagine when the baby's sucking, that is quite a strong force to draw the milk out. Often, sometimes as well, the initial letdown reflex of the colostrum can be a bit of a sharp pain. That should go away after a few seconds, and if it's not, then something else is wrong. I really hope you found this useful. If you've got any other questions, please comment below. And if you managed to get some colostrum because of this video, please tell me. I can't wait to hear.